Welcome to the Staying Healthy Assessment Training for Los Angeles County. Thank you for taking the time to participate. This training is brought to you by participating Medi-Cal managed care plans to assist Medi-Cal providers in Los Angeles County in implementing the new Staying Healthy Assessment forms. These forms are also referred to as SHA. This training will take approximately 20 minutes to complete. Today's training will include an overview of IHEBA and SHA, goals and benefits, the SHA completion and documentation process, available resources, and use of electronic SHA or other alternative IHEBA tools. Before we begin, let's take a brief look at a few definitions. DHCS is the California Department of Healthcare Services. DHCS is the regulatory organization overseeing Medi-Cal managed care in California. IHA is an initial health assessment required by DHCS Policy Letter 08003. Completion of a behavioral assessment tool is a required component of an IHA. The terms IHEBA and SHA are not interchangeable. IHEBA is a generic term for the behavioral assessment required as part of the IHA. And IHEBA is used to identify and document patients' health education needs related to lifestyle, behavior, environment, culture, and language. SHA is the specific assessment tool sponsored and approved by DHCS. DHCS requires providers to administer an IHEBA to all Medi-Cal managed care patients as part of their initial health assessment and WellCare visits. The initial health assessment must include a history of the patient's physical and mental health, identification of high-risk factors, assessment of need for preventive screenings or services and health education, diagnosis and plan for treatment of any diseases. The IHA must be conducted in a culturally and linguistically appropriate manner for all patients, including those with disabilities. In June 2013, via Policy Letter 13001, DHCS released the new DHCS-sponsored IHEBA forms called Staying Healthy Assessment, or SHA. DHCS requires Medi-Cal providers to administer the SHA or other approved assessment forms starting April 1, 2014. The new SHA was developed based on feedback from providers and allows for more accurate documentation of the educational needs of different age groups. Providers are encouraged to begin using SHA as soon as possible. Let's now look at the goals of an IHEBA. Since SHA is a specific IHEBA, these are also the goals of the SHA. Goals are to identify and track patient high-risk behaviors, prioritize patient health education needs related to lifestyle, behavior, environment, culture, and language, initiate discussion and counseling regarding prioritized high-risk behaviors, and provide health education counseling, intervention, referral, and follow-up. The benefits of completing an IHEBA or SHA include builds trust between provider and patient, improves patient-provider relationship and patient satisfaction, allows for the development of more personalized care plans, streamlines HEDIS documentation, ensures members receive preventive health services, and provides a way to easily document patient counseling. This table illustrates the periodicity of the SHA. The new updated SHA forms have expanded age categories, including 0 to 6 months, 7 to 12 months, 1 to 2 years, 3 to 4 years, 5 to 8 years, 9 to 11 years, 12 to 17 years, and adults. There is now a new assessment specifically for seniors. New members must complete the SHA within 120 days of enrollment as part of the IHA. Subsequent SHA administration is required at the next doctor appointment after entering a new age group. Current members who have not completed an updated SHA must complete one during the next preventive care office visit. Annual review of the SHA is required for members aged 0 to 17 years during the years between administering a new SHA. Subsequent SHA administration is required every 3 to 5 years for adults and seniors. Although not required, Policy Letter 13001 recommends that adolescents 12 to 17 years complete the SHA without parental or guardian assistance beginning at 12 years of age or at the earliest age possible due to teen health confidentiality laws and to increase the likelihood of obtaining accurate responses to sensitive questions. The PCP will determine the most appropriate age based on discussion with the parent guardian and the family's ethnic and cultural background. Annual readministration of the SHA is highly recommended for this age group due to rapidly changing risk factors. While there are no designated age ranges for the adult and senior assessments, the adult assessment is intended for use by 18 to 55-year-olds. The age at which the PCP should begin administering the senior assessment is based on the patient's health status, mobility, and chronic conditions, and not exclusively on the patient's biological age. Annual readministration of the SHA is also highly recommended for seniors. When asking patients to complete the SHA, provider offices should explain the purpose of the SHA and how the information will be used. Assure the patient that the information is confidential and kept in the patient's medical record. Encourage the patient to self-complete the SHA if age appropriate. Let the patient know that the SHA is available in multiple languages and that interpreting services along with accommodations for any disability are available. If preferred, providers can ask SHA questions verbally and record patient responses directly into the patient's electronic medical record. Patients may refuse, decline, or skip any or all parts of the SHA. However, patient refusals must still be documented and kept in the patient's medical record. Patients who refuse to complete the SHA should still be encouraged to complete a new SHA every subsequent year. PCPs are required to review the SHA with the patient. Other clinic staff may assist with this review as long as medical issues are referred to the PCP. During the review, the PCP is required to verify risk factors and determine the extent to which these risk factors may be harming the patient's health. These risk factors should then be prioritized and discussed as time allows. Whenever possible, the PCP and the patient should develop a mutually agreed upon risk reduction plan. Based on the patient's behavioral risks and willingness to make lifestyle changes, the PCP should provide tailored health education counseling, intervention, referral, and follow-up. The adult and senior SHA have a new alcohol screening question based on U.S. Preventive Services Task Force recommendations, questions number 19 and 23 respectively. This new question assesses whether over the past year the patient has had the following number of alcoholic drinks in one day: 4 or more for women and seniors, and 5 or more for men. If the patient answers yes to the alcohol screening question, the provider must offer an expanded screening questionnaire. Audit or Audit C are recommended. Audit is a 10-item questionnaire that assesses whether alcohol use is impairing the member's functioning. Audit C is a 3-item questionnaire that assesses the patient's consumption level. These screening questionnaires identify patients with potential alcohol use disorders who need referral for further evaluation and treatment. When the Audit C or Audit C score is high, the patient should be referred to treatment. When the score is medium, the patient may not need to be referred to treatment, but should be offered 1 to 3 15-minute brief interventions instead. Providers must attest to having completed special training before they can offer screening, brief intervention, and referral for treatment services, and cannot offer these services prior to being trained. If a patient answers yes on the SHA alcohol screening question, untrained providers must either refer the patient for SBIRT screening by a trained provider or schedule the patient for follow-up after training has been completed. Training will be available online from a variety of free or low-cost educational websites. DHCS may also provide training for Medi-Cal managed care health plans. Contact your health plan for more information. The new alcohol screening benefit went into effect January 1, 2014. Documentation on the new SHA is easy. For an initial SHA, the PCP signs, prints his or her name, and dates the questionnaire on the second page. The PCP also documents the specific behavioral risk topics discussed and checks the types of interventions offered to the patient, such as counseling, referral, anticipatory guidance, or follow-up. During the intervening years between readministration of the SHA, the PCP signs, prints his or her name, and dates the SHA annual review section of the questionnaire. A signed SHA must be kept in the patient's medical record, even if the patient declines to complete the SHA. Patient refusal to complete the SHA is documented by checking the box "Patient declined the SHA" on the second page and including the PCP's signature, printed name, and date. Another benefit of the SHA is that it can be used as an additional document to show evidence of certain HEDIS measures that require patient counseling, referral, provision of anticipatory guidance and follow-up. This ultimately helps streamline the HEDIS auditing process. For example, appropriate documentation for the pediatric obesity HEDIS measure can be documented by checking the nutrition and physical activity topics in the clinic use only section of the SHA questionnaire, as well as by checking the counseling, referral, anticipatory guidance, and follow-up ordered boxes. PCP's signature, printed name, and date of service must also be documented. Other HEDIS measures for which the SHA can be used as documentation include the anticipatory guidance component of well child and well adolescent visits, chlamydia screening, HPV vaccination, and prenatal postpartum care as appropriate. Other adult and senior HEDIS measures for which a completed SHA can be used as evidence include chlamydia screening, prenatal care, care for older adults, functional status screening, and advanced directive. Please remember to notify the health plan of all pregnancies by completing a pregnancy notification form. Let's now take a look at how to appropriately complete and document the SHA. Arrow 1 indicates where the patient begins to fill out the form. Arrow 2 indicates the shaded clinic use only section on the first page. This section, along with the comments section on the second page, is used to take notes regarding patient discussion and recommendations. Arrow 1 on this slide points to where patients can write down any other health concerns or questions they may have. Arrow 2 highlights answers circled in the middle column. Any answer in this column indicates a risk factor. Note that middle column answers may be yes or no, and that yes and no are not always in the same column. If a risk factor is identified, the provider must explore this topic with the patient and determine the extent to which it may be harming the patient's health. This slide also shows that any question may be skipped. Arrow 1 on this slide is the clinic use only section on the second page. This section documents which topics were discussed and what types of assistance were provided to the patient. Assistance options include tailored health education counseling, referral, anticipatory guidance materials, and follow-up. For each health topic addressed with the patient, one or more of these boxes must be checked. Arrow 2 is where the PCP must sign, print his or her name, and date a newly administered SHA. Arrow 3 is the comments section, which may be used to take notes about patient discussion and recommendations. This section can also be used to note changes to patient responses or to provider recommendations during annual reviews. Arrow 4 is the patient declined the SHA box, which is used when a patient refuses to complete the SHA. To fully document a patient's refusal, enter the patient's name and date on the first page, check the box Patient Declined SHA on the back page, and have the PCP sign, print his or her name, and date the back page. This slide highlights the documentation required for HEDIS and annual review. Arrow 1 is the clinic use only section. This section indicates what topics were discussed and what type of assistance was provided. To be acceptable for HEDIS, this section must be completed. Arrow 2 is where the PCP documents subsequent SHA review. Refer to the periodicity chart to determine how often reviews should happen for each age group. The PCP must sign, print his or her name, and date the SHA annual review section. The SHA must include this documentation to be permissible for HEDIS. Arrow 3 is the comments section on the second page. This section may be used to note changes to patient responses or to provider recommendations during subsequent SHA reviews. Most SHA forms are available for download and printing on the DHCS website at www.dhcs.ca.gov/forms/pages/stayinghealthy.aspx. The SHA is available in 7 age categories and 12 languages, including Arabic, Armenian, Chinese, English, Farsi, Hmong, Khmer, Korean, Russian, Spanish, Tagalog, and Vietnamese. Arabic, Farsi, and Khmer are not accessible on the DHCS website. These languages are available through your contracted Medi-Cal managed care health plan. The SHA may be used in an electronic format under certain conditions. Providers must notify their Medi-Cal managed care health plans at least 2 months prior to implementation. Electronic formats include manually adding SHA questions into an EMR, scanning SHA and then placing it into an EMR, or using SHA in another electronic or paper-based format. Any electronic SHA must include a provider signature. The SHA questions must be the most updated version and may not be altered from the original version. Your health plan will review the electronic format to ensure it meets all requirements prior to implementation. DHCS and Medi-Cal managed care plans strongly encourage providers to use the SHA. However, an alternative behavioral assessment tool may be used but requires pre-approval by DHCS. An alternative assessment tool is any other tool that is not SHA. A request to use an alternative assessment must be submitted to your Medi-Cal managed care health plan 2 months prior to implementation, along with a copy of the proposed alternative assessment. The request must also include evidence that the alternative assessment contains similar content, risk factors, and administration periodicity as the SHA. The request must also be accompanied by copies of the alternative assessment tools translated into the appropriate threshold languages for each contracted county. Your health plan will submit this request to DHCS. Requests for previously approved alternative assessments must be resubmitted every 3 years. Providers may use the American Academy of Pediatrics Bright Futures Assessment without DHCS approval, as long as certain conditions are met. Contact your health plan for more information. Additional SHA resources are provided on the DHCS website and include a SHA Provider Office instruction sheet, a list of all behavioral risk questions by health category, and pediatric and adult questions referenced by age category. The DHCS website also includes information regarding SHA provider training opportunities. All Medi-Cal managed care health plans in Los Angeles County can provide assistance and resources in implementing the SHA. Available resources include the availability of SHA forms in multiple languages and age categories, including the availability of the forms as writable PDFs, 24-hour 7-day-a-week in-person or telephonic interpreting services, easy-to-read, culturally and linguistically appropriate health education materials, health education services such as health promotion and disease management classes and counseling, and access to a nurse advice line. For more information or for assistance with SHA implementation, please contact your contracted Medi-Cal managed care health plan. For Anthem Blue Cross, please call 866-465-2272. For Care First, please email healtheducation@carefirst.com or call 323-889-6638 extension 3282. For HealthNet, please call 800-804-6074. For LA Care, please email healtheducation@lacare.org or call toll-free 855-856-6943. For Molina, please contact your Molina Provider Services representatives. Thank you for participating in the Staying Healthy Assessment Training for Los Angeles County providers. On behalf of your contracted Medi-Cal managed care health plans, we hope you found this training beneficial.